Hello, this is Dr. Gay from First Leg MRI, and this is a patient who had pain in the neck and the right shoulder. The main thing was the shoulder, and they wanted to find out what was causing the shoulder pain. They thought since the neck was hurting, maybe there was a disc herniation in the neck, but they decided to do both the shoulder and the neck at the same time because they didn't want to miss something in the shoulder. And this is a really common finding we have here, where we have symptoms that can be explained by either a pinched nerve in the neck or something intrinsic in the shoulder. And it's complicated because there are findings in the neck that would explain the shoulder pain and also findings in the shoulder. So if the patient had just had an MRI of the neck, we would have seen these disc herniations I'll show you in a minute, and we would have said, okay, we have the findings, we're all done, and we'd miss the abnormality in the shoulder. And so some doctors, like this doctor who ordered this, knew that is often the case, and they ordered the cervical spine and the shoulder at the same time. This also goes with the lumbar spine. Lots of times people have pain in their hip or leg, and they want to know if they should have a hip MRI or a lumbar MRI, and some doctors just order them both because they know there could be findings in both. So after that long introduction, here we go. This is the neck. You can see these little squares of the cervical spine, and down here we see this little black line, another black line. These are the intervertebral discs. These are the shock absorbers or the cushions between the bones. And we can see that the disc is poking out backwards here. This is the front of the neck. Here's the back of the neck. And there's a disc herniation poking out the back. And it's pushing and compressing on this thing. This gray thing comes out of the brain here. This is the brain stem. It comes down. This is the spinal cord. And coming down here, we see the spinal cord is flattened and compressed at this level. Also, another disc herniation here at this level is compressing the cord. So you have significant compression of the cord. There's this moderate central canal stenosis. If we roll off to the sides, we see these openings where nerves come out. Well, on the right-hand side, the foramina where the nerves come out are severely narrowed and the nerves are severely compressed. So this would explain pain on the right side, but also we have findings in the shoulder. This patient has a little bit of motion here, but the rotator cuff comes off sideways from medial to lateral, and the tendon comes down and attaches way over here on this round ball. This is the humeral head, and we can see the rotator cuff should be black, but if we go forward, we see white fluid, and that white fluid is within a hole of the rotator cuff. So it's a full thickness tear of the rotator cuff. You can see that fluid-filled tendon gap right within the tendon. It comes down, ends, fluid gap, and then it attaches over here. So this patient unfortunately has pain from a couple things. One, from the rotator cuff tear, and also from pinched nerves in the neck. And so that is why it's really hard to answer the question, should we have the cervical spine or the shoulder, or should I have the lumbar spine or the hip? Sometimes it's good just to have both of them, and then you really understand where the pain is coming from. And that's it. Thank you very much.